Instead of relying on stun guns and tasers, hospitals are turning to high-tech surveillance and communication systems to protect their patients, staff, and facilities. And increasingly, security and IT departments are coming together as a team to design, install, and maintain these sophisticated new systems, according to Health Facility Management Magazine's 2012 Hospital Security Survey. This is Hayden Bush for H&HN Daily, and I'm joined today by HFM editor Mike Herkowitz to take a closer look at this year's results. Mike, thanks for joining us today.
Thank you, Hayden.
Mike, what did this year's survey focus on?
Well, one of the conclusions we reached in last year's security survey was that hospitals were more frequently adopting high-tech systems to supplement their security staffing. So this year we wanted to focus further on this issue by finding out how security supervisors and facility professionals were working with IT departments to integrate these high-tech systems into hospitals' IT infrastructure and keep them running effectively. What we found was some disconnect in the perceptions of the two groups. For instance, 50% of the CIOs surveyed said they have specific IT staff assigned to support security systems, but only 36% of the security supervisors and facility professionals believe that to be true. Likewise, 82% of the CIOs said computer servers for security systems were located in the IT data center or computer room, but only 63% of the facilities and security respondents agreed with that statement. This disconnect also became apparent when respondents were asked at what point IT becomes involved in security system operations. In all cases, the IT respondents believed they were more involved than the facilities and security respondents believed they were. Clearly, there is a great need for better communication among IT, security, and facility professionals.
And what kind of security systems are popular with hospitals this year?
Well, Hayden, among existing installations, electronic access control, vendor management systems, wired panic alarms, digital video surveillance, and mass notification systems all dominate the hospital's security efforts. For the next couple years, hospitals are most frequently planning to implement radio frequency identification systems, visitor management systems, digital video surveillance, mass notification, and electronic lockdown systems.
What security changes are hospitals making in terms of policies and procedures?
We found that the vast majority of hospitals are conducting security assessments and updating their security strategic plans at least once a year to keep on top of potential threats. And so far, these assessments and plans have not led to wide use of firearms, stun guns, or similar devices, which are still relatively rare in U.S. hospitals.
And finally, Mike, what were some of the findings around security budgets?
Hospitals are still putting a lot of money behind their security efforts, with the vast majority reporting that they're getting the same or greater funding than they did last year, which also showed impressive numbers. In fact, 7% of the hospitals are increasing their security department budgets by more than 10% this year, with another 11% increasing their budgets by 6 to 10%, and 28% increasing their funding by 1 to 5%.
Mike, thanks for joining me today.
Thanks for having me, Hayden.